Hello, welcome to a panel today. So, panel discussion about how stress impacts Black women's health. So, I have medical doctors here with us today. So, I normally talk about Black women in toxic jobs and I cite research and I reference about my own healing. But today, wanted to talk about from a medical perspective. So, in terms of the physical and mental health implications of stress. So, I'm going to turn it over to my guests for them to introduce themselves. So, as you're coming into the room, give this video a thumbs up because you know it's going to be good. And if you have not already subscribed to this channel, please do so. Lifting As We Climb Consulting Wellness Services. And just to introduce myself, I'm Dr. Kamani. I'm a licensed clinical psychologist and also a toxic job survivor. And I'm ushering in a movement to help as many Black women as I can to leave and heal from toxic jobs. So I'm going to have my panelists introduce themselves, and then we're going to get right into the discussion. So Dr. Wyatt, if you could introduce yourself, and then we'll have Dr. Lawrence-Reid introduce herself as well.
Sure. Thank you. And thank all of you for joining. Ron Wyatt, I'm an internist by training, practice medicine in St. Louis and here in Huntsville, Alabama for about 25 years. I am a senior fellow at the Institute for Healthcare Improvement based in Cambridge, Massachusetts. And I am chief science officer and chief medical officer for the Society to Improve Diagnosis in Medicine. Thank you.
Awesome. Thank you. Dr. Lawrence-Reid.
Hi, everyone. I'm Dr. Naomi Lawrence-Reid. I'm a pediatrician based in San Diego, California. I'm also founder of Doctoring Differently, which is a educational course platform and a consulting company that teaches physicians about their alternatives outside of full-time clinical medicine and gives them the direct tools and resources and research to be able to forge their own path outside of full-time clinical work. Thank you for having me.
Absolutely. And just briefly how I met them. So Dr. Wyatt literally was posting a number of articles about stress and health implications for Black women on LinkedIn. So you may have seen those articles that I was reposting. And then I was like, you know what? I'm gonna reach out to him and see if he can be a guest. And he said yes. So that's how this kind of came to be. And then Dr. Lawrence-Reid, I interviewed her, I think she said 2 years ago, about her experience in a toxic job and leaving and pivoting to something different. So I wanted to have this discussion again with medical doctors so we could talk about the impact of stress for Black women's health and also to emphasize that we can pivot, and recognizing that stress is very harmful. So panelists, we're going to start with in terms of just a general understanding of the difference between just regular everyday stress and chronic stress. So if we could just kind of have a playing field for understanding that. So if you guys can distinguish between regular everyday stress and chronic stress. And the panel is whoever wants to answer.
I'll defer to Dr. Wyatt to go first.
Yeah, I saw the question, and this is how I'd answer that. Everyday stress leads to chronic stress. It's a daily experience.
Mm-hmm.
And we'll talk more later about the chronic stress that evolves out of that. And to not bear the lead at all, the everyday stress that leads to chronic stress leads to premature death.
Ooh.
That is where this ends if it's not interrupted or disrupted.
Yes. And Dr. Isom has joined us. Dr. Isom, hello, how are you?
I'm doing well. How are you? How are y'all?
Good to see you. So we just got started. So if you could just briefly introduce yourself, and we just started the conversation. So if you could let the audience know about who you are.
Absolutely. So my name is Dr. Jessica Isom. I am a community psychiatrist based in the Boston, Massachusetts area. I work at a federally qualified health center part-time. And the other hat I wear is around workforce development, formerly in the Yale Department of Psychiatry in the Social Justice and Health Equity curriculum, and elsewhere under the umbrella Vision for Equity LLC, specifically focused on racial equity work. Nice to be here. Thanks.
Yes. So Dr. Wyatt was just distinguishing the difference between everyday stress and chronic stress, but he was saying that, ongoing everyday stress becomes chronic and that can impact your mortality, right? So that's why it's so important. So I'm wondering if we could talk about some of the possible physical and mental health issues associated with chronic stress. So again, panel open, whoever wants to answer, okay? So what are some of the physical and mental health implications?
Well, I'll start with the physical implications that I've seen. I am a pediatrician, but I understand in the context of this discussion, in the context of almost every discussion I have at my job, we talk about what are called ACEs. And I know that everyone in this panel probably has heard of them, but those are adverse childhood experiences that set a child up. First of all, that's stress that is being likely often transferred from a parent or a guardian to a child at any age. We've seen ACEs, those kinds of traumatic experiences affecting infants. So as young as infancy. So knowing that this discussion involves, if we're talking Black women, we have to talk about communities and families too. That's generally the nature of how our societies are set up in our worlds. And so it's the transfer of that stress, which, as Dr. Wyatt said, I mean, the definition of chronic is something that's happening every day. So those chronic stressors, because we don't live in vacuums, and as I said, as Black women, we live in communities, we live with families, people depend on us, and so that stress is often transferred to children, and it is very, very, very difficult for a child to overcome a lot of those stressors. We can see time and time again that those stressors that happen to them, that stress that's transferred as young as infancy, changes can affect the trajectory of the rest of their lives.
Yes.
Their own health. So I recognize I started to talk about the physical implications of health, and I'm sure we'll get into the hypertension, the insomnia, the sleep, the infertility. I mean, it affects every aspect of our lives. Whether it's obesity, whether it's malnutrition for some people. But again, being that my focus is often children, that's where my mind goes first if we're talking about stressors as a Black woman in our communities and our families.
Yeah. So it's interesting because I want us to talk about not only the implications for children, because when you think about ACEs, right, in terms of having that negative impact on physical and mental health. So if you already have ACEs growing up, and then as you have become a woman, a Black woman in this society, in a toxic workplace, so you have all of that additional stress, right? So that allostatic load. So it's just like this ongoing stress that cause our bodies to kind of just wear out, right? So I'm wondering if we could talk also in terms of for Black women, what are some of the things that you all have seen in your clinical practices? And even Dr. Lawrence-Reid, the mothers, right? So what have you seen for Black women in terms of the physical and the mental health issues related to stress, and particularly toxic jobs, because the toxic jobs can cause a lot of stress. So I wanted to open it up for that.
I'll let Dr. Isom talk.
Yeah, there's lots. I'll say that you see. So as a psychiatrist, one could say someone presents with anxiety or depression or some other things like their relationship with substances and view that in isolation. And we all know, hopefully, that you can't view any of it in isolation. There's a connection between your environment, your exposures, your past, as the ACEs discussion reveals to us, and then how you deal with what's happening in the present. So I'll talk about moms. A lot of my patients are Black mothers who exist in workplaces of various kinds, whether it be an Amazon delivery job, working for the post office, working actually in the hospital. And they'll talk about the experiences that they have in the workplace and how those can often be around a boss, a supervisor, or even a peer, and how there are elements of that are both, of course, race and gendered. So, for example, one of my patients is a hospital employee, often working with majority white nurses, often working with majority white healthcare providers, and trying to navigate that environment while also dealing with an anxiety disorder, while also dealing with PTSD and some other things. And a lot of times when we're talking about what's going on with her, it's not just what's happening with you in isolation, it's what's going on with you at work. This patient in particular had to move. Because there was a particular dynamic in one of the locations in the hospital that was causing her a lot of distress. Unfortunately, she was able to move to another team in the hospital to help. There are other stories, however, where people will stay and bear and grit through it and suffer the consequences, or they'll actually leave their jobs. So not being able to sleep, it affecting the kind of healthful eating behaviors that you engage in or don't. It might affect your ability to have a healthy relationship with substances, for example. I'll often hear moms talk about going to work, dealing with the stress, and then coming home and having a glass of wine that might become 2 glasses of wine that might become a bottle. And then we're having a conversation around, well, how do we address that? And at the same time, have an empowerment-based conversation around how you deal with, what's happening in the workplace. The last thing I'll say is that it's not just the job. They also are caretaking for children who themselves are experiencing racism in their settings. So they might be advocating during parent-teacher conferences for their children, dealing with a racist landlord who won't get the mice and cockroaches out of their home by being responsible. There's just so much. So that overwhelming stress has many ramifications, not only for them, but also in their caretaking roles as well. So
it makes me think about Dr. Wyatt and the research that you cited, right? So I just came to, as I've been researching more about this, right? So the initial research that I saw was from the American Heart Association, talking about how Black women are now dying at earlier ages, we're developing cardiovascular disease earlier, and that we're very much impacted by external issues like you all have been talking about, the intersectionality, racism, sexism, all these other things. So I'm wondering, with the research that you cited, can you talk a little bit, because everybody here may not have seen that research. Can you give an overview of some of the research that you posted on LinkedIn?
Sure. So I'll go into that, and let me just start this way, because just a brief story that can help you see this, the way it operates. And I say that with intention. It is a system that operates. We can't get into this work without understanding the operating system that in the United States is racism.
Yes.
It is structural, it is institutional, it is personally mediated, as Dr. Isom just alluded to. The story, though, is a 44-year-old Black woman who came to see me first visit when I was a physician in a fairly qualified health center here in Alabama. She had type 2 diabetes. She was referred to me by an endocrinologist, a white endocrinologist, that actually taught me how to take care of diabetics. When she came in, we did a random finger stick blood sugar. It was over 400. It was a
I don't know what that means. Can you tell the audience what that means?
That's life threatening.
Oh God! Okay. Wow.
When I began to talk to her about her condition, again, she was a certified nurse assistant working in long-term care, which in any given day is stressful.
Yeah.
More so for a Black CNA.
Yeah.
So I said, okay, we're going to change your medicines around, and I want to see you back in 2 days. Did some blood work on her. When I got her blood work back, what we call a hemoglobin A1C, which tells me something about your blood sugar control over about 3 months. It told me that her blood sugar had to have been 400 or more for the last 3 months.
Oh my God.
So when I said, okay, we are now going to work on the things that will keep you alive and bring your blood sugar to normal. She broke down in tears. And I waited, and I said, tell me what you're feeling. And he said that the endocrinologist, and I won't call his name, he's still in practice here, that sent me to you, told me it didn't matter what I did, that my blood sugar would never be normal.
What?
So that is what we call internalized racism.
Wow.
Because she come to believe no matter what she did, she would never have a normal blood sugar. And we got her blood sugar to normal. Underneath that is trust.
Yeah.
And mistrust and no trust. When what we call evidence-based best practice is practice for some people and not others.
True.
It advantages some people and not others. So then when you look at the studies for Black women around stroke and heart attack and heart disease and hypertension and high cholesterol that are all either not treated or undertreated for Black women, then the term I use, that makes Black women in the United States healthcare system 2 things: sacrificial and disposable.
Wow.
That's the reality of it. And there's a history to it. And I tell people in this work, go back and look at the history. We can go back to 1619, but we can go back before 1619 because this kind of violence toward Black women started even before 1619.
True.
And you can go back to the father of modern gynecology who used his enslaved women to practice his trade and bring it all the way forward to where we are and the things that Dr. Isom and Dr. Lawrence-Reid are talking about. So when you get those studies that and the high cholesterol, the hypertension, the strokes, the heart attacks, when you go back to what's the root cause, as Dr. Lawrence-Reid talked about, it is the situations that women and Black people are put in every day. Well, my good friend David Williams there in Boston, Dr. Isom, I know David, talks about everyday discrimination, everyday racism, and it expresses itself in these chronic conditions. And then when Black women come in with these symptoms that Dr. Isom talked about, that will be decided as they're vague, they're atypical, and then women get these labels, right? That is something else, but it's really just the day-to-day discrimination and racism. It leads to irregular menstrual periods. It leads to decreased sexual desire. It leads to headaches and anxiety and continue downstream to chronic diseases. It leads to headaches, difficulty concentrating, difficulty sleeping, low energy. And I will bluntly say that when those symptoms are brought in to the U.S. healthcare system, where most of the physicians are white and most of the physicians are white men, they discount those symptoms. And to me, I will just end with this way. What you see in the literature, what we see in the data is violence.
Yeah.
It's violence against Black women in this country, in the U.S. healthcare system. And I will even provocate and say the failure to act on what you see in front of you is violence. If you say as a physician that a blood pressure of 140/90 is okay, that is violence.
That's horrible.
So I'll stop there. But that's what the studies support. These are empirical studies. They're not something that somebody pulled out of the air. It's looking at data, at empirical data, and saying there's something here that is violence against Black women.
Yes. And you know what? Positively Pro I just posted a comment and I'm feeling the same way. I feel like I want to cry because it's heartbreaking, right? Just as Black women that we have to go through so much just to live in a society, just to have a job. We're just trying to live. And then when we're sick, we go to the doctor. But then, as you said, we're disposable. And there's so much racism within the healthcare system. So we're going to talk about what to do about this, but it is very sobering. It's very sobering. And, you know, something else that I had read about too, which was sobering, was the whole idea of weathering, right? So can you all explain to people who don't know what weathering is, what that is, and what the implications are for Black women in relation to weathering?
Can I say this first? I talked to Arlene Geronimus, who coined the term 12 years ago. And she was under all kind of fire because of what she talked about as weathering. And I'm going to defer to Dr. Isom because if I sum it up, it is social injustice that goes to the physiological level. And it actually now has been demonstrated that weathering actually changes your DNA.
Wow.
Yeah, I mean, so, you know, what comes to mind for me is my experience of pregnancy. And this is why the workforce development piece is so important, because this conversation never came up. And I was being served where I trained at Yale New Haven Hospital, this prestigious institution, you know, it's supposed to offer high quality services. I'm a high weight person. So I was with the maternal fetal medicine specialist and considered a high risk pregnancy because of my weight. So I overly interacted with healthcare professionals, including specialists. And the whole time I was pregnant, essentially, I was waiting to get preeclampsia, just waiting for it to happen. One of the things I remember was they would measure our blood pressure at all of these visits. And I was hoping that when my blood pressure was measured, it wouldn't be high because then I'd have to deliver, you know, my baby early. I was super anxious about that. I was anxious about being a Black woman that was pregnant and being subjected to, during my pregnancy, chronic stress. And one of the things that never came up during any of these encounters was all that we just talked about. My ongoing daily exposure to chronic stress in the body that I was in as a pregnant person, the kinds of healthcare interactions that represent racism interpersonally and at the institutional level, none of this was ever discussed. So it's as if you're entering into the institution with this aura or this cloud of racial gaslighting. Your actual experience supported by the data is not being acknowledged, not being discussed, and not being addressed. So all of those stereotypical recommendations that you would offer to a person in my position, such as, oh, you should exercise and lose some weight, it's not going to do a damn thing for the fact that I exist in this body, have experienced these things in my childhood, will experience these things tomorrow, and I'm interacting with the system and individuals within it. They're not responsive to my needs. So as I was listening to that offer from you, Dr. Wyatt, it is violence. It's an action in the face of need. And it's a disavowal of violence that often it goes unacknowledged by the system. But weathering essentially is that the arc of the story of existing from the womb to the tomb in a society that's structured to neglect you, discriminate against you, and then overexpose you to indignities that stress your system. The book by the author that you mentioned, Dr. Wyatt, it talks about parallels between stress from poverty and distinguishes how that's different from structural discrimination connected to race. So there's some parallels, some overlap, but distinctions as well. And I'll pause there and just say, the quote I offer to my patients, to myself, is you are not going to kill me. You are not going to kill me. And that's because weathering at the end, it brings the tomb closer to us than it should be. It shortens our life expectancy. It increases the onset of disability, the age. So instead of having disability at ages of like 60 or 70, we're having debilitating conditions as 40 and 50-year-olds. So shorter lifespans, and then having less life years lived free of disability from these chronic conditions. So there's a lot there.
So we're looking at the quantity and the quality of life because of these external stresses like racism, all these other structural issues. And you know what's so noteworthy too, when you shared your story as a medical doctor, pregnant, right? Getting so-called high quality medical care. Dr. Wyatt, you talked about just the racism within the system, right? Dr. Lawrence-Reid, you talked about even in childhood, all these stresses. And I just want to just highlight for the people listening to this, that it's not just when people say, oh, it's just poverty. It's not. It's across the board for Black women. It doesn't matter what your socioeconomic status is. It doesn't matter what your profession is. You can be, like you said, working at Amazon, you could be in the post office, you could be a medical doctor, right? So these issues permeate all of our systems. And that's why it's so important for us to have these conversations. So I see a request. What is the name of the book again?
Weathering by Arlene Geronimus.
Arlene?
Yeah, Arline, Arlene Geronimus.
Okay.
And what she talks about in Weathering, in my language, it's the day-to-day beatdown. It's that's the weathering, like you would see when a porch or bricks are weathered by storms.
Yes.
Right. So it's Arline Geronimus, Jeronimus, and it's systemic oppression that impacts physiology. It impacts our bodies. It leads to premature aging, even, and the levels of diabetes that we see, because what it does also, it affects what we know as the adrenal glands. The adrenal glands help regulate stress hormones. Weathering causes an increased cortisol level. Increased cortisol levels cause weight gain and predisposes people to type 2 diabetes. And you track it back to weathering and the day-to-day just beat down. And to your point, in one of the articles that I shared, it goes across every educational level.
Right.
And it's been demonstrated time and time again. My good friend in Carolina, Charity Watkins, has a PhD. And she almost literally begged her physicians that something was wrong. They told her it was a virus. Her husband is a PhD virologist. And he said it's not a virus. By the time someone listened there at this prestigious institution in North Carolina, her heart function was less than 10%.
Oh my God.
A Black woman with a PhD.
Wow.
And the stories that people bring to me about this Black women are endless.
Yeah. Yeah. I read an article, I heard somewhere talking about the life expectancy for a Black woman who has a higher degree is the same as like a white woman with like an 8th grade education or something like that. I was like, what's happening here? Does anybody know about that research?
Overexposure.
Oh.
In a lot of ways, the way that I conceptualize this is it's overexposure to sources of stress and overexposure to indignities. If no matter who I am and what I do, if no matter how good or excellent I am, I'm being confronted with the same indignities, I think that does something to the spirit, the soul, and obviously the body.
True.
At a physiological level.
True.
Not to discount that if you don't have a higher education or some high powered position that you also are not experiencing those. I just think the manifestations can be different.
Absolutely. And I think that's the part that we miss a lot is that many times the social programmings that we're told as Black women, we work, Black people, right? That we work twice as hard, we get half as much, and we do it. Like we get, all the degrees, we do all these different things, but we don't recognize a lot of times we're going into very hostile workplaces and that we're always under attack. So that cortisol is just streaming through our bodies. And you all just talked about the impact that the cortisol can have. So for Black women who are watching this right now, we have Black women here right now watching us, commenting in the chat. So if there's a Black woman watching this right now, and she is saying, I hate this job. I am stressed out from the job, being a mother, all these other things. I'm stressed out. It's wearing me out being a Black woman in America, okay? I'm stressed out. What words of wisdom or what tips can you offer to her in terms of, number one, how can she tell that the stress is getting out of whack and it's affecting her? That's the first thing. How do we promote that awareness?
I mean, I would start with telling such a woman in terms of at least initial recognition. First of all, when you know. And I'm only saying that to acknowledge the fact that you don't need, there is no test. You don't need another person to diagnose you or to validate you, because so much of what we're talking about is gaslighting from medical institutions as well. Your boss will say, no, it's not that bad. Your colleague will say, no, it's not that bad. Your partner, someone who lives in your home would say, you're just overthinking. She didn't really say that. It's not that bad. You need this job. We need this money. All of that, it depends on, your environment, the people around you. But I think we've arrived at this discussion because of all of the things Dr. Wyatt and Dr. Isom have mentioned, but lack of acknowledgement of Black women's knowing about themselves and their stresses. So all I say is to any Black women, to any people listening, you already know. You know, you don't need us to tell you. Hopefully our words are resonating with you and you're saying, yes, that feels right. Oh, yes, that's happened to me. Yes. But at the end of the day, you don't need us to be the ones to tell you that your job is toxically stressful. So that would be, first of all, and I for what I do in my business is for physicians exclusively, for all physicians. But, of course, a large part of my audience and work is Black women. You attract who you are. And so I myself, after 3 years of working in full-time academic clinical practice, realized that this system was not set up for my success as a physician. And as Dr. Isom said as well, as physicians, we also are exposed to the microaggressions or macroaggressions, everyday stressors of, despite being highly educated, we are not safe either. But for my work, I recognize that, there's a medical institution that, yes, it is the worst for Black women, but in terms of physicians, it's not really set up for any of our success.
Wow.
Therefore, it's not set up for patients' success and their health either. So for me, it was getting to that breaking point in 2017 where I thought I have to go. I didn't have a whole lot of savings. I had a whole lot of medical education debt. But at the same time, I just knew that, listen, I have one life. This path is not cut out for me. I trust me. I trust myself. I couldn't look for a lot of validation. In fact, I knew I couldn't look for validation in my community, honestly. Oh, and not that my community wasn't supportive of me. It's just that no one knew a doctor who wasn't working in a hospital or clinic.
Right.
And so I was told, what you think you want, you can't have. It's not possible. It was well-intentioned, I think, for many people. It really was well-intentioned, but it was rooted in their own ignorance.
Yeah.
So all I have to say is to the people listening, the women, the Black women listening, it comes truly down to trusting yourself and believing yourself, because we are taught that we don't know what we're talking about, that we're being hysterical, that we don't know enough about ourselves and our own bodies and our own minds. So I that is my advice, that trust yourself. If you need to leave, listen, you have all the tools in your mind, in your body, you have your faculties. If you're above ground, you can make a change in your life. And that's what it comes to. I know all of our situations are different, our fields and what we do, but it truly comes down to this. Where I am currently standing is not working for me. It is not working for my family. And because I have autonomy and freedom over my body, I'm not enslaved. I can actually choose to make a difference and a change in my life for myself and for my family.
I interviewed Dr. Lawrence-Reid about 2 years ago, so I'll put the interview with her in the description section, and Dr. Isom interviewed her, so I'll put her in that interview in the description section as well. Dr. White, I think you want to say something as well.
Yeah. So just to show you how this operates. Years ago, I was teaching in the medical school here where I am, and it was the first of the month, so I'm picking up a new teaching service. And the program director, a white male family practitioner, met me in the doctor's lounge and said, "I need you to take over this team, not the team that you're assigned to." And I said, "Well, why?" Well, it turns out that the second-year resident on that team is a Black female physician. And he said to me, "Well, she's not doing very well, and we don't think she's going to make it. So we would like for you to take over the team." So I said, "Well, wait a second. What I hear from you is that as a Black physician, if I take that team and then I'll come back and say you're right and validate your opinion of her, that's what you need me for."
Yes, to throw her under the bus.
To validate getting rid of this Black female. So when I went to the service after rounds, I said, can we talk? I didn't know her. And I said one thing, "Tell me what's happening." She started crying. She said, "My husband is an engineer. He got addicted to crack cocaine. He sold the car. He sold all the furniture. I can't pay my mortgage. I can't pay my child care for my 2 children." And I think, okay, I have seen white residents where the same program have provided mental health services, the same program that had helped with child care, the same program that had helped other white trainees with housing.
With housing.
So what's different about her that you're going to say, "Ron, if you tell us that she's not a good physician, then that's it for her"?
Wow.
All right. So I went back and said, "She's one of the best residents I've ever had because of what she's dealing with that none of you had the courage to even ask, or the concern to ask, or the compassion to ask, or the respect to ask." And to this day, in this town where I'm right now, she is one of the best, most highly thought of physicians in this town.
I love it.
So as we go into this, we have to take the steps and have the courage to say no. I'm not going to perpetuate this violence on people based on something that is so deeply embedded in your psyche that you can't get over it.
Yes. And so you see the racism, but you called it out. But what I love about it is that you went directly to her and you checked in with her to see how she was doing, and you offered that support and you advocated for her. And I think we need more of that in the workplace. So that was a beautiful example of really being there for each other and dealing with so much hostility that we deal with in the workplace. So, so we're saying that these things, recognize for yourself. You can tell for yourself if something's not good for you, right? You can tell, right? But the other part I'm curious about see, I love these conversations because something more comes up and I'm like, wait, I didn't think about that. So if a Black woman, and I see in the chat, people are talking about this, if a Black woman goes to the medical doctor and she doesn't trust her doctor is saying ridiculous stuff to her that she's like, that doesn't make sense. Or she could tell that her doctor's not really following up with her appropriately. What tips can you offer to her?
I have this conversation often with my patients. I am a psychiatrist and I am their Black doctor. So like, we're going to talk about it all.
Yeah.
So I review the chart. They see the specialist, all this good stuff. And I'll ask them questions about their experience. Like, do you know what's going on with your knee, or like what the steps are, for following up? Did you get the appointment? Like all these sorts of things. And I've had patients tell me that they've gone to a visit and they've had positive experiences, of course, but also they've had experiences where they felt disrespected and discriminated against.
Yeah.
I have really empowered patients who will say, I'm going to switch doctors. Like, I'm not having this.
Good.
I have patients who will report. They'll use the compliance office to actually file a report against a provider or healthcare professional. I see patients asking for documentation. So can you describe for me and summarize, what we talked about in this visit, send me a letter or a MyChart message. I want to lead with that I do see that. And then the recommendations that I would offer would be pretty similar. A lot of it's around addressing internalized racism in the form of low expectations, which is that you deserve to be able to leave the visit understanding what your doctor said to you. Like, you deserve to be able to call and follow up with the nursing line or the physician to ask the questions that you need to ask. Like, you deserve all of these things. And that's a direct intervention on internalized racial oppression, which tries to convince us that we are not deserving of things. It's also a direct intervention on the healthcare system's racism in the form of not educating all patients across the board, and specifically racialized minorities, on what they're supposed to expect from healthcare encounters. So we are socializing some patients into being more deferential, docile, and passive. And we're also socializing other patients into being more proactive and engaged. So we have to intervene on that as well.
Yeah. And my hope is that the message that people hear about ways that they can be empowered, about how to advocate, how to say, this is what I need, that won't prevent people from going to the doctor. Because I don't want to go to the flip side of, I don't want to go to the doctor, you can't trust them. They're, all these other kind of things. So it's important to have that information. So is there any way around this? Like, given that we have racism, sexism, that's not going anywhere. Okay. What can we do? I mean, we're aware of the signs, which is important. We go to our doctors, we know how to advocate. What else can we do about this? Because if we're under chronic stress, what can we do about it? So is it, if we leave a situation where it's high stress, does that have a positive impact on us? Can it kind of reverse or mitigate what may be happening? So I'm like, what do we do? Right. So if we're in a really toxic job, what are the best ways to do? Or even after we leave the job, is it possible that the health outcomes can be improved by us not being under this constant duress? I'm just trying to figure out what the steps are, what we can do in these situations. All of you, please help us.
Well, speaking for myself, who did just that, I do believe, and I will defer, I think, to Dr. Wyatt and Isom, who probably have the most up-to-date information. I would imagine it affects you. Can it be fully reversed? I would imagine on some level there is improvement. It depends on how long it lasted, how long you were in that job. Were you in there a year? Were you in there 30 years? Well, that's going to make a difference when you leave. So there's so many factors about the reversal. In my personal opinion, it's never too late to leave. It's never too late to change. So it does not matter how long it's been. Guess what? It will start getting better when you go. So we can talk about, I could not predict for one person, but I could say that generally for most people, yes, your sleep improves, your skin improves, your blood pressure improves. Those are tangible metrics, right? Those are things we actually can measure. And so those things that we can measure, yes, there's improvement across the board. Sometimes there is, if you've had sustained hypertension or chronic hypertension for years, there will be irreversible damage caused. And that's just damage to organs that, you take that pressure away, that organ is still damaged. But guess what? That's better than that pressure continuing, right? True. So I just, there is no, it's too late For me,
Yeah.
I don't believe in just resigning myself to my circumstance. And I don't think any of your listeners or anyone tuning in should feel resigned or stuck in their situation, you know, and I think many of us, most of us have maybe been in an experience where we're like, okay, what are my options out?
Yes.
I am trapped. No, I need this job. This is the only XYZ in this area. I've got these bills. I got this family. I've got these things. There is always a path from where you are to where you want to be.
True.
Always. And it's truly starts with your mindset. I realize that that's a very intangible thing to say, but it really is true. Because if you don't get someone once said, you know, if you think you can or you think you can't, you're right.
Because you've already bought into the defeatist mentality.
Exactly. I just want to encourage, and I recognize, you know, we started off just talking about, you know, the reversal of stress after leaving a situation. I just don't think I think there's always a path out and a way out and around a stressful situation. And, you know, you may get out of it and think, man, I should have done that a lot sooner. But it's never too late. Start now. It starts with starting, and you can start at any time.
Yes, thank you. What about you, Dr. Wyatt? What are your thoughts about that?
Yeah, I'm going to refer to Dr. Isom first, and then
Okay.
Yeah, I'll say one, co-sign all of that, Dr. Lawrence-Reid, and also to talk about the after the departure, the recovery period, which can take a long time, take years to recover from that toxic exposure. So thinking about what you're going to do during that recovery period is really important. One thing that came to mind for me is like the socialized habits that come from being in a toxic job. There might be ways of connecting with your boss or your supervisor that you've been conditioned to do, ways of connecting with your peers in the workplace that you've been conditioned to do, ways of coming home that you've been conditioned to do because of your exposure to that toxic work environment. So recovery is about, well, now that things are different, how am I going to be different? What are the things I'm going to put into place, the things I'm going to not tolerate, new boundaries, things of that nature, so you don't fall back into those patterns, because those expectations exist in lots of workplaces. So it's possible that you might transition into something with similar elements or the exact same elements, and you having recovered means that you might be more prepared to recognize it sooner and leave, or mitigate some of the impact while you're there. And then also, it's not going to take weeks. It's going to take months to years, depending on what area of this you're talking about. So just being patient with yourself and compassionate with yourself is important.
Yeah, I appreciate what both of you guys talked about in terms of choices and options, and that you can get out. And even if you happen to end up in another toxic job, right? That the first we got is horrible. You end up in another one, it's still bad. But more likely you can recognize the signs faster and know that you can get out. So that's good. Thank you. What about you, Dr. Wyatt?
Yeah, so I mean, this marvelous from Dr. Lawrence-Reid and Dr. Isom. So I'm going to go to a different area, because I mean, they're the experts in that. So I'll say a few straight things. We need more Black doctors. All right. We need more Black physicians. We need more Black people going to medical school and graduating and completing training and going into practice and becoming faculty and being promoted as faculty in academic centers, so that we increase these numbers in a different way. So start there. I'm headed off to Chicago in a couple of days, where one of the big payers there is working on this right now. And a big payer, has said to academics in Illinois, here are the targets you must hit for medical students, for trainees, and for faculty, or we won't pay you as much.
Wow.
That's my next stop. We have to get into how healthcare in this country is paid for. We cannot pay for racism. No. We cannot pay for bias. We cannot keep paying for prejudice when the outcomes in the papers I put up tell us, right, that we are, what's happening to Black women is the way the system is designed.
Yeah.
It is designed to do harm to Black women. So that has to be disrupted. That's got to be disrupted through policy. It has to be disrupted through payment. It has to be disrupted through teaching. It has to be disrupted in the C-suites, executive suites, and at the level of the board. There are organizations that I work with across the country that have now declared that we are and will be an anti-racist organization. we are looking at our data and stratifying that data. And we know that Black women are a population that is impacted in terms of facts, right? The outcomes, the harm and the injury and the death that we see and we've experienced in training. So taking a strategic approach is where I am. And the next part of that is regulation and accreditation. If you're not meeting the requirements from the federal government or from accreditation, that will impact an organization. So part of that now is forcing organizations to, again, break down your data by gender identity. And if it comes up that Black women aren't getting the cancer screening, aren't getting the diabetes control, aren't getting the hypertension control, the cholesterol is not being treated appropriately, Black women that will get a procedure versus a bypass surgery, Black women who will get anti-inflammatory medicine and as opposed to knee surgery. I can go down the list. So what we're trying to do is disrupt all that payment. How this system is being supported, and that's a bigger task. And to Dr. Lawrence-Reid's point, it's going to take some time, but this is urgent.
Yes.
This is urgent.
Yes.
We have to come at it from different strategies, different approaches, from different tactics and operations.
Yes, I love that in terms of the different strategies and kind of covering all angles, right? But looking at holding people accountable.
Yeah.
Right. So these institutions getting more of us in the field. Now, there's something I want to ask you guys before we start winding down. Something I hear a lot from Black women is that they will contact me and they'll say, I hate this job. I dread Sundays. I dread the whole Sunday, right? Because I got to go back to the job on Monday. I'm crying going to work. I'm crying leaving to work. Everybody in my family, all my friends know about the job, but I'm going to just try to stick it out. If I could just hold on until I retire or until my child graduates, what would you say? Because it's a lot of Black women who say this. What would you say to a Black woman who is saying this and she is stressed out about that job? She's having headaches. She can't sleep. She's gaining weight. All the things you all talked about. But she's saying to herself, I'm going to try to stick it out. Or if I could just hold on until. What would you say to her?
Yeah.
Well, for me, it would depend. You could do a little. It depends. It depends on the method. I'm not a psychiatrist, so I just talk to people sometimes straight, and I'll say, at this rate, you may not make it. You know, for what you're describing about your health at this moment, you sound like you could have a stroke at any day. And I suspect that job would replace you in a week or so.
Yeah.
Pass, but the people who mean the most to you would mourn you forever. So I would maybe try to put things in perspective. Again, that depends on who that person is and how they may respond to those words. Sometimes it's tough love. Sometimes you need to be a little softer with the mitts on. But I talk to physicians who say that who I speak to, who say those exact things to me.
Wow. Physicians say that.
Oh, yes. Oh, yes.
They know better. They really know better.
They actually don't know better. And I don't want to get in too deep into it, but we are trained and groomed as physicians to stick it out, to be the most resilient. Our training is so toxic in our medical school and residencies, and it's toxic for everyone. But you say that this is a Black medical student, a Black man, a Black female. I mean, that's a whole other level. So we are trained to be the most. That is literally our residency and our fellowships are taught. You will be awake for 30 hours in an ICU taking care of patients. It is not about you. It is not about your body. It's not about your needs, your wants, the wedding you need to go to, your child who's at home. None of that matters. This is what matters. So yes, we know, I think we intimately know, I think Dr. Isom and Dr. Wyatt are agreeing, or maybe there's some shared experience in their own training, because we as physicians know exactly what a lot of that feels like. And in addition, that expectation, like, don't complain. You signed up for this. This is new. This is what you knew. This is what you went into.
Wow.
And so that's why, at least for me, when Dr. Wyatt was saying, we need more Black doctors, I knew I had to do something and make a change in my life and create something that changed the lives of other physicians, because I could no longer recommend this field to doctors, to high school and to college students who are approaching me to be mentors, to write letters of recommendation. I couldn't do it. In my first few years as a physician, I thought this is not good. Why would anyone do this? We thought we all had our vision at the very beginning, and as society, doctors obviously esteemed and all the things, but we assumed we would be protected on the other side of our training. We assumed that things would get better, and too often they do not.
Wow.
So at that point, I knew I needed to create something from my own personal experience, having explored the many job and opportunities outside of full-time clinical medicine that are available to all physicians that we are not taught about. We are taught that crying on the way to the hospital for a 24-hour shift is what we signed up for. That's our duty.
Wow.
That's our goal, at the cost of our lives and So at that point, I knew I needed to create something so that I could recommend this profession, and we could have more Black doctors and doctors of college, just diversify this field. Less than 3% of physicians in this country are Black women.
Wow.
So we are very much a minority. And I read at one point there was a statistic that there are fewer Black men in medical school now than there were in the 70s.
Yes, it's true.
Wow.
Thank you, Dr. Isom, for co-signing that. I was like, I know I did not make that up. So there is, so for all of us, I mean, and back to just Dr. Wyatt's point, for all that needs to be the revolution that needs to happen, for all of the systemic change that needs to happen around payers, around hospitals, it starts with, it really is up to physicians. Honestly, we are that thin layer that is just so critically important that none of this whole system crashes down without us. Advocating for our patients, deciding what can and cannot happen, what we won't put up with payers and corporatized hospital medicine. So for all of those things, I think that, I don't even remember what the question I was answering. I'm sorry. I've gone off on a other tangent. I've gone to 8 different places.
But deep, because I'm like, I'm going with you. I'm like, wow, that's fascinating.
I know. I think I was inspired. I have my little poster from, I saw Beyonce's Renaissance movie.
Oh, nice.
Put that out at the movie theater. So I'm feeling all the Renaissance feels. So, but all of that to say, it comes to us. We can make a change, make a difference. All the things I've been saying.
But you know what? It goes back into Beyonce. Why? Let me tell you why. Right. So Beyonce, "You Won't Break My Soul." That's my new favorite song. Right. So when I was resigning and that became my favorite song because I felt like the job was trying to break my soul. And what you're talking about is related to that. So the original question was for Black women who say, "I'm trying to stick it out. Can I hold on?" Right? But you answered it.
Okay, good. Woo, good. Yeah. I'll leave push my mic away then. I'll let someone else.
No, you answered it and you added so much more to that conversation. So in terms of just thinking about as Black women, as we go into the workplace, we go into these environments to try to break our souls. And what's so disturbing is that it doesn't matter how far you go in terms of your career, they still try to break your soul. And it comes to a point, like you just said, you just have to have real talk conversations. Look, based upon what you're saying, I don't know if you're going to make it, right? Let's just real talk. I don't know if you're going to make it. And so having that honest conversation is so important. So yeah, you answered it. You answered it. You did so much more. Yes.
And I would say, I mean, I know there's a person who comes to mind who I met in my lifetime. I'll leave it vague, who I'm still connected with, who represents that. A lot of our conversations had been in this context around their increasing health conditions, eye stuff, the pain they experience, when they're moving around the workplace, the severe levels of anxiety they experience in the workplace, how that's connected to their smoking habits, that they ain't never gonna quit because the stress exposure is so constant. This person's close to retirement age. This person has a child who has a serious mental illness who relies on them. They're responsible for a household. It really is keeping on until retirement for them. So I'll say for that particular person, if that's you in the audience, you definitely deserve validation in the contextualization of your experiences. You didn't bring, glaucoma to yourself. You didn't bring obesity on yourself. You didn't bring your knee pain on yourself. You're not just smoking because of yourself. Viewing your situation in context, you're a person exposed to chronic stress who's trying to survive and live as long as they possibly can. But unfortunately, for some people positioned in that way who lack access to wealth,
Mhm.
options. A lot of times for them, it's just literally trying to make it through. I would also recommend maximizing your benefits. So take the sick day, let the job figure it out, maximize those, pursue FMLA. We have that here in my state in Massachusetts. That's family medical leave, do
Mhm.
PFMLA, do all the things.
Mhm.
But if you can create space between yourself and your job while still maintaining access to your source of income and providing for your household, maintaining access to your insurance through your employer for all the conditions they, contributed to, that you're using those things and not centering the job's needs over your own while it's actively harming you. So
Yes.
the things I would offer.
So important. So important. Dr. Lawrence-Reid, you want to say something else? Yes.
Yes, just very quick. I teach this as well. If you are reliant on your job for benefits, as our system has been structured and so many people are, the Affordable Care Act does allow you to get your own benefits outside of a full-time employer. So that can be a place to start. Go to healthcare.gov. It is still open enrollment for your state's marketplace. Each state has its own marketplace where you can enter your household income, the number of people in your household, how often you go to the doctor, how many prescriptions you need, and you can get plans or options for plans to be able to purchase your own high quality health insurance independently of your employer.
Good. Good. I'm gonna put that on the screen. Thank you. Thank you. Thank you. Thank you. Dr. Wyatt, what about for you? What about Black women who say, I'm just trying to stick it out, I'm trying to hold on until, but she is stressed out. She might be watching this right now.
So what my wonderful colleagues just shared is a plan. If you listen back to what they gave out a plan. So I'll end on this and say, when a person says to me, I hope that it will get better someday soon. I say back, hope is not a plan. Someday is not a time. And soon is not a time, and someday is not a number. So have a plan. Act on your plan. Maintain your health. And there may come a time in your plan that you know that it is now time to be someplace else. That is an excellent survival strategy. Change the ground you stand on, but have a plan to do so. And don't rely on that hope will get you there. I will say be impatiently optimistic about your plan and make it happen.
Yes. So take your power back and be proactive, right? Okay. So as we're winding down, if you guys can share just briefly with the audience, what are the services that you currently offer and how people can contact you? So we'll start with you, Dr. Lawrence-Reid, because you started talking about how you pivoted, right? In our discussion, talked about pivoting. So if you could talk about what service you offer now.
Sure. So my company is called Doctoring Differently, and I teach physicians about their options, their lucrative, flexible career options outside of full-time clinical medicine. So my platform is exclusively for physicians, MDs, DOs, across specialties, across the country, and honestly, across the world at this point. I've been able to connect with so many physicians on 6 continents who are everything that I have said about physicians. It turns out it's actually it's happening across the world, and so we're feeling it all over. So yes, I want it to be again a centralized resource for physicians who've experienced the stressors, the toxicity, the trauma that so many of us truly have, but haven't had the protection that we thought we've had. So again, you can find more information at doctoringdifferently.com. I'm most active on Twitter or X at Doc Differently, and I'm on Instagram as well. You can look me up on all platforms. That's where I am. And again, I'm most active on Twitter, but my message is it's for physicians, but I'll tell you, I am contacted by people of all specialties. I have dentists and veterinarians and psychologists all saying, hello, anything for me? What can I do? And I encourage all of them to say, listen, a lot of the things I say, if a physician is saying it, I know that you, wherever you are in your life, you can make your change. You can let me know how I can support you doing what you do. My message and my experience is very unique to physicians. However, there are so much of the foundational elements and are applicable to, I think, every single person in the society. So
Absolutely.
I'm so happy to hear. So thank you for having me, and nice to connect with all of you.
Absolutely. And I just want to say it is absolutely fascinating because I'm getting calls from around the world, like Australia. And I'm like, whoa, Netherlands, UK. And I'm like, it's the same parallel experiences.
It is.
And so Black women, I just want to say, unfortunately, so many of us have had or are in a toxic job. We are here to tell you that it's dangerous. Be aware of that, right? The stress can really impact you. We're talking about options, okay? So be aware of the options. So thank you, Dr. Lawrence-Reid. I'll put your information up here on the screen. I'll put that in the description section as well. What about you, Dr. Isom?
Yeah, I appreciate that. It definitely resonates about so much of what you said, Dr. Lawrence-Reid. So thank you for what you do. A lot of people need that. And we'll continue to need it as we churn out more and more folks across the pipeline. So you'll stay busy. I'll say I do workforce development. So Dr. Wyatt laid this big picture of what needs to happen, and I focus on the training aspect. I do enjoy being a medical educator. I like it. So for me, it's a way of using my public health background to have a population health impact by engaging in workforce development. So I've done that asynchronously through creating content that people can watch that's recorded, or creating curriculum, or live. So engaging in workshops and trainings, including longitudinal relationships over years with particular organizations. So that's what I do. It's Vision for Equity LLC. There's information out there on that. I appreciate the opportunity also to be here with you all, because I feel soul nourished when I join you on your show all the times that I have, and also to be in community that's validating and affirming and speaking facts. It's really lovely. So
awesome. And is your website visionforequity.com?
Yes, with a 4.
Oh, okay. Okay.
The number 4. Yes.
Okay. Okay. And I just want to say too that I appreciate there's so many beautiful, brilliant people that I've met on social media. You know what I mean? Like, I've never met any of you in person, but I've reached out to each of you, and each of you are like, yeah, okay, I'll come. And I'm so full with that. I'm so full of gratitude that each of you took the time out, and all of my guests come on, because we know that we are in crisis as a people. We're in crisis. And so we know also as Black women, we are in crisis. And so I just appreciate all of you. So I'm going to put your information up here, Dr. Isom. Okay, thank you. Dr. Wyatt.
Yeah, so thank you. So I am founder of Achievement Equity LLC. You can find me on LinkedIn is the fastest way. My work primarily is multi-level. So I have a group of physician executives that I coach, not all at the executive level in these topics. I work with a couple of state hospital associations, foundations, executive leaders, governance boards, payers, around health equity, health inequity, and most of what I talked about here. Even before this call, working with an organization to create more robust and valid measures around inequity, and making sure that the proper types of risk assessments are done to eliminate disparity. So I work in the measures development. I work on the policy side. I go on Capitol Hill and the other entities I talked about. But the most valuable work that I have is with now, I think about 16 physician, all Black physician executives, and they all face the same challenges. It's what we call, particularly for Black female physicians, it's the glass cliff. So Black female physicians, they get promoted into executive positions. They aren't given teams, they aren't given budgets, they aren't given resources. The expectations are unrealistic. And then if they don't have results in 6 months, they get kicked off the glass cliff.
Wow.
And then what we talk about, some typically white male physician lands on the golden sofa.
Wow.
So I coached individuals about how you can navigate through that and maintain your health, and those strategies and tactics that will lead to stronger resilience in this minefield that we all find ourselves in, that both the doctors here have talked about.
That's deep. See, again, a lot of stuff you all talked about, I never knew any of this stuff. Now, I heard of the glass cliff before, but I never heard of it from the perspective of medical doctors. And you said what, the golden sofa? Is that what you said?
Yes.
Oh my God. Okay. Wow. Okay. So I know we're a little over. Doctors, I hope you can stay open for just a little bit while we read the chat. Okay.
Sure.
And I always like to give space for the chat because this is a good community here. Okay. So everybody's saying thank you. I'm talking about ACEs, the allostatic load on Black women has far-reaching effects. Yes, it does. Thank you for this event. Learning already. Blessings. Good evening, everyone. Looking forward to this. Great forum for educators. Speaking truth. Thank you. What about a majority Black environment? Now, I want to say something about this. Okay, so I've done videos on my channel, many. Okay, all skin folk and kinfolk, right? So what we're talking about, racism, it doesn't matter the skin color. We're looking at structural racism. So it could be another Black person who is engaging in white supremacist behaviors. They don't have to necessarily be white. Okay, that's my perspective. What do you guys want to say about that?
I mean, structural discrimination exists no matter what people, quote unquote, you're around.
Yeah.
And then also Black people are other things. So there's going to be gender dynamics, class dynamics. There's going to be personality challenges. We're in our full humanness. There are going to be dynamics within the Black community that will also produce stress as well. And at the same time, that's distinct from the stress from structural discrimination.
Yes.
Right. So it's that intersectional aspect of this. And here's a true fact and a data that supports it. When Black physicians, we go to medical school and training, we become socialized in a different way. And if you're not sensitive to that, you begin to make the same types of judgments and use the same stereotype bias that other people use. So part of my work is also to help people be sensitive to that socialization process.
Wow.
That comes through in some microaggressions when I've heard the term, well, you know, Ron, you're different, right? And no, I'm not. I'm a Black man in America. I know who I am, right? So you can't patronize me and socialize me to think about my people a different way because you're with me, right? But that socialization takes place in the what's called an implicit association test that measures bias. When that test did this with Black physicians, there was also a certain degree of racial bias. And one of the explanations and more research to come, that some type of let's be explicit, pro-white socialization can take place.
Wow.
Absolutely. So we all have our work to do. Okay.
Wow.
We all have our work to do.
Wait a minute. Now this is mind blowing. So you're saying in medical school, in the medical whatever, that there's this socialization to make those doctors feel like they're special, they're different. So then they start seeing other Black people, other Black patients, and looking down on them.
That's what I'm saying.
That's deep. Okay. Racism, sexism, systemic. 60% of Black women are prone to preeclampsia, and I'm sure chronic stress is part of the problem. Hello, everyone from Cali. Hello, my dear friend Colette Elizabeth. Make sure you like this video, everybody, because it lets YouTube know to suggest this video to other Black women, okay? Let's see. Wow, just fired my white doctor. Sacrificial and disposable, which we were talking about before, Dr. Wyatt. All my health issues went away as soon as I left my job and got therapy. My tachycardia, I hope I pronounced that correctly, stabilized. Blood pressure became normal and no longer pre-diabetic. Wow, that is truly a lie. It can't turn around. Wow. Okay, this is true. Well, I'm in tears over here. My white female doctor discounted me. New docs for the new year. Good. Chills all over. Thank you. Very sobering. Yes. And Black women are 60% more likely to suffer from preeclampsia. I'm sure chronic stress is involved. Is that true?
Yes.
We're not genetically different, so there has to be another explanation.
Right. That's
wow.
right.
Wow. Okay. So I'll put the information about the book in the description section, everybody. Okay. That's wonderful. Issues are affecting us all. Wow. I'm sharing this. Let other Black women know to tune in. Good. Thank you. Thank you. Oh, here it is. Here's the name of the book right here. Okay. So that's the book, everybody. Okay. Check it out. Thank you. My cortisol was out of control. Yes, education is not the great equalizer, as we have been told. That is so true. And I would say, I think sometimes the higher you go up, the more venom that you are subject to. I definitely can experience that. Let's see. You're welcome. I hear you. I'm working on mine as we speak. Such an important topic. Glad to be here. Just because I carry it well doesn't mean it ain't heavy. So true. Yes. As you can do it as a high earner, they say don't leave that good job. No job is a good job if it kills you. Boom. That's Stephanie Perry quoted that too, right? A job is not a good job if it's killing you. And if you're accessing the health benefits because a job is stressing you out, that is not a good job. Okay. We can find other ways to get money. Okay. I'm off balance and I can feel when I'm off. One of the main problems that affects Black women is we think the outlet to our trauma, regardless, is a cultural trauma, racial trauma, any type of trauma, is either pleasure or producing. I'm not sure I understand that.
I think I read that as that some believe that we don't have other options. Like more liberatory options in response to our conditions beyond pleasure seeking and maybe producing in the form of children or producing in the form of work products.
Got it. Okay, thank you. I just recently left that good job working on recovery now. Congratulations. Prayer, I love that. If you're above ground, you can make a change in your life. Yes. When I explained that I left felt my high blood pressure was due to work stress, my doctor told me to get over it. Oh my God. Everyone has stress. A year later, my blood pressure was low. My doctor asked what happened. I told her I quit my job. Oh my God. Okay, that's so infuriating. Oh my God, compounded stress to protect them from liability. Kudos, Dr. Wyatt. This is how we should care for one another. Yep, the dangerous 3 Ps. Sorry, not, okay. Called it out with grace. I just hired a Black female as a psychiatrist. I have a white female therapist. After I quit my job, my blood pressure, A1C, and my good cholesterol improved to the point where my new doctor, thank you for getting a new doctor, Colette, has begun weaning it. I love it. What an amazing transformation. Thank you for sharing. I'm looking forward to the same results. I'm empowered now. Thank you all. They're like, okay. The physical health impacts of toxic jobs are so real, and the mental health impacts linger long after the physical effects go away. So true. That's so true. There'll always be a path to where we're going or where we want to be. Once I left my toxic job, my sleep improved, my hair grew back, my skin is blemish free. I'm still in the healing journey, but I'm alive. Yes, you are. I'm so happy that you left that place. Oh my God, yes. Yes, I wound up in another toxic job after I left the first one, but resigned within a month because I understood the signs. And that's my VA right there, right? So we worked together and I'm so proud of her. Okay. This conversation is powerful because we're often discounted and disregarded in the workplace when we try to speak up and advocate for ourselves and our counterparts. The mental gymnastics we are forced into just stay employed and sane is exhausting. Yes, it is. So they're currently reading Set Boundaries, Find Peace, A Guide to Reclaiming Yourself by Nedra Glover Tawab. I don't know if I can pronounce that correctly. I love this conversation. I'm also realizing that once you leave the toxic job, it's also equally helpful to put distance between yourself and toxic people if you can. Yes, friends, family, etc. Absolutely. Protect your boundaries. Hold these organizations and mega corporations accountable because as a collective, we are dying. It's an epidemic. So true. The recovery process from a toxic job environment and the system is a journey. Left my career over 2 years ago and still have a ways to go. I'm in a much better place and getting to sleep. I've been on a sabbatical over a year now. I don't want to go back to work. I don't want you to go back, sis. I hope you can find another way. Hold them accountable and create support to one another. I'm absolutely loving this conversation. Thank you, doctors. I needed a break. My therapist suggested I read this to help with setting boundaries. Unfortunately, in my job, I was caping for my employer, always saving the day and allowing them to follow. Oh, that's so toxic. Yep, I developed a substance abuse disorder due to the notion of productivity in a toxic environment. It's ugly out there. Yes, this is absolutely an epidemic. Toxic jobs are ending our lives prematurely. So true, Marissa. Thank you for sharing that. Yes, it's like they are committed to trying to break our soul. Yes, so true. This was validation. Didn't realize I needed for years of abuse from physicians that disregarded my intuition and symptoms. Thank you for this remarkable conversation. Thank you, sis. I felt like such a failure 18 years ago when I left Black excellence behind to become a stay-at-home mom. I don't regret 1 minute of it. Sounds like it might have saved my life. Yes, 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 yes. My friend and colleague was terminated last week after returning from FMLA. Oh, that's horrible. That's horrible. I hope your friend is able to find better, less toxic situations. Okay. As he's staying at home is so honorable. Life is so expensive right now, and the average family can't afford to do that for their children. My mom was, and I love coming home to see her. So in terms of we need some change in society, yes, we definitely have to do some things. My observation as well. Those you mentioned, a couple of others. See, they're following you all. I'm letting you know, guys. They're following you guys. Okay. Really, really great work. Thank you for all you shared. Hurt people. Yes. Many organizations that fight for BIPOC treat Black folks the worst while benefiting from calling out anti-Blacks in the world. Girl, I could do a whole nother video, a series on that. Okay. With regards to medical training, it is true that doctors and our nurses are medically trained that Black women have a higher threshold for pain or thicker skin, literally. That part. If you're not aware of what you're in, you will adopt the oppressor's ways. Teach. I've never been trained by any professional job asked to make it happen, giving less with higher demands. Being Black and trying to make it out of poverty is a second hit to how we are treated and how we are positioned or not meet our needs, bless you, or development. Yes. Do that series. Okay. You would do a series. Okay. Okay. So everyone, I want to say thank you so much for this very powerful panel. I learned so much today. I really appreciate all of you. So again, thank you for taking the time. Audience, thank you for being a part of this conversation, sharing your comments. Please listen to what was shared in this video. Please share this video with at least 2 other Black women. Okay. If you know a Black woman, more than likely she is in a toxic job. Help her out. Okay. Share this video with her. Give this video a thumbs up. If you haven't already subscribed to my channel, please do so. Lifting As We Climb Consulting Wellness Services. And I will see you all later. Doctors, if you guys can stay up for one moment. Okay. Thank you, everybody. Have a good night. Bye.